Marlene is there again. Okay, maybe you can sit next to me. And maybe there are some questions in the chat. I can have a look. There are questions for Ruth and questions for, well, I think we can, I'll read the questions out. Can you speak to what Martha Nance calls terminal agitation, like fearful grimaces at the end of the life? Are you familiar with this concept? And if so, how do you care for these residents when experiencing such psychological pain? Well, we experience it now and then, but I think really the PDL care is helping us to reduce pain. And of course, we try to find out what makes patients grimace, and then we try to alleviate their problems. And sometimes it's hard to find out, with our psychologist in the team, together with the nurses and the doctors and the psychiatrists. They really want to find out if someone is in psychological pain. And it can be very hard to find out. Last month, I had a patient and he was in real big pain, and he said it, and I even gave him morphine. And actually it appeared to be a psychotic experience of pain. So it didn't help, the morphine, but when I started the antipsychotic medication, it was diminished in 1 or 2 days, and he was happy to be back to normal again. So it can be very hard, but yes, we always try to find out what's going on. I congratulate you on your presentation. Would like to know what kind of changes you observed in the diet. I'm not completely sure whether I can answer this question. Maybe we can have contact personally, and maybe I can contact you with Marina Eckel, the PhD student who did all the work for this research. And then from Zainab from the EHA, dear, thank you for the presentation. Is there fast staff turnover in such houses of care? Being an HD family member and having an experience of having the same nurse for my sister with HD for 4 years, I'm wondering if there's a syndrome of burnout among the HD care personnel in the centers of care, and how do you deal with that if the burnout takes place? Thank you in advance for the answer. I think we have quite some turnover of personnel, and we are looking for how can we keep our personnel and how can we keep them healthy. And I think PDL care is a nice example of how people think they're having a meaningful job and they're able to take time for one patient. And I think we're lucky in the Netherlands that patients with Huntington's disease get quite a lot of money for 1 day in the nursing home. So we really are privileged. Paul, sounds fantastic for Manon, but in reality, how can it be implemented in countries where one-to-one care with a nurse is impossible? Oh, well, if I understand this question from Dina, you think we have one nurse for one person, and that's not the kind of thing. We have one nurse per, I think about four to 6 patients during the rush hours. And Manon tried to stipulate, maybe explain, that normally the patients in their really late stage Huntington's disease, we care for them with 2 nurses
at the same time.
At the same time,
because it's so difficult to help them during the washing and dressing. So there's one on the left side and one on the right side. And PDL care is all about taking your time. It isn't quite, because it doesn't take any more time. That's yeah. So it isn't that we have one staff member for one patient. It's all about being in the moment with not with two, but now with one. I hope this clears everything. Yeah. Well, we're not so fortunate that. Yeah.
Well, and then Katrine asked us to do a short discussion, and I think it's 17:50, so I think we sort of managed. Could you please now come to an end? And we're happy that you have listened to us, and we really like to thank you for that, and wish you all a very nice continuation of the conference.
Yes.
See you. Okay. Bye.
Thank you. Bye-bye.
Next session, short communication. Afblaad, precies.
Brief meeting, denk ik.
Kijken of Marlene nog is.
Zijn we als enige nog?
Ja. Ik was muted. Ja.